All right, everyone. My presentation is on an eating disorder, a case study centered around a little girl. Eating disorders, a case study of a 10-year-old girl. Academically, she's in 4th grade. She's an excellent student, has really good grades. Her teachers say she's a perfectionist. Her behavioral analysis, we're going to go into the normal behaviors that she shows and the abnormal behaviors that she shows. We'll start with the normal first. Like I said before, she's a perfectionist. Her schoolwork, she does it to the best capabilities that she can. I don't see this as a problem. Some kids are just really focused on school and value it a lot more than others. Again, she's only 10 years old. This could actually be a good thing for her because if this continues, she'll do very good in her school and be a very successful person. Genetically, she's a bit overweight. This isn't really abnormal considering that her weight could be due to a slow metabolism or just eating habits in her family that she kind of took on her own. Abnormally, she started to isolate during recess. She's said to be a very outgoing person, so this is obviously abnormal. That just changed. She stopped eating lunch. She was reported to actually give her lunch away to other kids. Her mother was satisfied when the teacher had told her mother that she'd noticed that Lisa was actually losing a little bit of weight. I think it's kind of weird that her mother wasn't concerned like the teacher was. When the teacher was asked, she said that Lisa looked like she lost about 20 to 30 pounds in the 10 weeks that she was at school, and her hair became very dry and brittle. Factors. Race, ethnicity, and religion are not a factor of her symptoms in this case. Social economic status is kind of relevant in the terms that her father is kind of absent from her life, so economically they don't make a lot of money probably. It is also assumed that her mother put some verbal abuse towards her about her weight, and there's a lot of pressure for her to kind of lose the weight or not eat so much. But it's good to note here that eating disorders tend to be comorbid with depression and anxiety. Therefore, the fact that her father's absent and her mother's kind of like not the nicest about the way her daughter looks could maybe contribute to some other things. Diagnosis. Lisa actually ended up getting only a tentative diagnosis of anorexia nervosa. This means that they would have to do further observations and assessments to give her the official diagnosis because there wasn't enough information to do it right away. Just give you an idea of what anorexia nervosa is. It's the unwillingness to gain weight. You become 15% below the healthy weight line. You have this fear, like a very, very intense fear of being fat or gaining weight. Intense body image disturbances, and you tend to be in denial that you have an issue or that you're not eating enough. Like people with anorexia tend to be really good at lying about how much they eat. Based on her teacher's report, her behaviors are warning signs for anorexia. And if further investigated and observed, Lisa would more than likely be given the official diagnosis. Assessment, treatment, and findings. We're going to start with the assessment first. An assessment tool is going to be required to kind of solidify this diagnosis or to throw it out, which I personally think is highly unlikely. Intervention with Lisa's teacher and her mother with a CNS present is definitely going to have to occur regardless of if she's diagnosed or not. They're going to have to discuss Lisa's change in behavior, and they'll probably take note of her mother's reaction. The CNS can intervene in the conversation between Lisa's mom and her teacher at any time, as long as both parties agree. If the mother decides to accept and understand that there is a problem, further diagnosis will occur. Once the further diagnosis occurs and she's given the official diagnosis of anorexia, or her mom gives permission to kind of investigate it a little bit more, a physical examination will be done. This is recommended by the CNS just to kind of understand the extent of Lisa's possible disorder, to see exactly how much weight does she lose, is there any internal health problems like with her lungs or heart, like how much damage has she caused. Treatment. Regardless of her going beyond the tentative diagnosis, the CNS is going to want to meet with Lisa individually just to assess the situation, see if Lisa will talk about it, and possibly plan out some kind of treatment strategy. If she's given the actual diagnosis of anorexia, they're going to pull the neighbors in and see if they can help manage her eating habits while her mother's at work, because again, guys, at night she's left in the care of her neighbors. And then after all that, she's just going to be probably constantly monitored, and depending on how she does, other strategies might come to surface. So if she starts to show symptoms for depression or anxiety, those are things that are going to have to kind of be looked at and confronted as well. Just a finding, something for the CNS or any doctor or therapist that she talks to consider, is that Lisa's symptoms are actually commonly linked to body dysmorphic disorder. That could possibly be something else she's dealing with, something else to look into, just to keep in mind. My thoughts. I do believe in her tentative diagnosis of anorexia. Her behavior suggests common side effects to an eating disorder because of the weight loss and hair decay that she experienced. There are many reasons to lead me to believing that she definitely has this disorder. There's evidence for depression. The fact that she isolated from her friends after being known to be a very energetic, outgoing girl. She started to withdraw from fun activities. She started to lose that focus in school. Her isolation is also common to anorexia itself, as people with anorexia actually become kind of ashamed of themselves. They kind of start to hate themselves, and because of that, they think that people have that same feeling towards them. So they just become kind of antisocial, become very withdrawn, hide away. It's possible that she's having obsessive thoughts about her weight loss. It's very essential to eating disorders. She lost the focus in school and her grades dropped, so it kind of makes you wonder, well, where's her mind at then during this time? Also, just another result of depression, which is a common comorbid of anorexia. If she has depression, it makes sense that her grades and everything dropped, because people tend to lose interest in things that they always found important and valuable to them. And then it's possible that instead of focusing on school, she was focusing on her food and weight restrictions. Thoughts? The pressure of her mother and the fact that she doesn't have a father figure is something to really look at in this situation. Her mother is suspected to be kind of verbally abusive about her high weight, which is something that's kind of detrimental to a young child. It forms insecurity, puts pressure on her to need to be skinnier because she thinks that's going to satisfy her mother, and she's going to want to get her mom's approval, which can cause a lot of problems down the road for her. The fact that her father isn't a part of her life is almost a gateway to depression. She's going to start to form kind of daddy issues. She's going to feel worthless. She's going to wonder, why didn't my dad stay with me? Like, what did I do? And then when she starts to have future relationships, either with a guy or a girl, depending on her orientation, she's going to either be a very cleany, needy kind of spouse, or she might actually find herself in abusive situations or not be able to connect with people. I really enjoyed this case. Honestly, I thought it was really interesting. I kind of got to see eating disorders from like a younger perspective, because a lot of people don't realize that 31% of children are diagnosed with some kind of eating disorder as early as 5th grade. That same percentage goes to children who have been said to have dieted for the first time by the time they're 10 years old. So I like this case study because it doesn't focus just on teenagers. It focuses on a age before being a teenager, which is still really relevant to this disorder, especially in our society where the media puts a lot of emphasis to be a perfect size, and it affects kids too. I don't understand why the symptoms were not further investigated. I think Lisa has enough symptoms to be given the official diagnosis. I definitely think the mother needs to be evaluated for her own possible issues that could have really triggered her daughter. The mother seems to have something with weight, whether she's just kind of depressed and angry because of maybe a failed marriage or something with Lisa's father, or she's got body image issues herself. The verbal abuse isn't normal on her part, and she should probably seek some kind of treatment or help for that. Just to kind of cover all the bases, I think there should be some kind of observation within Lisa's peer group and her other classmates, just to rule out any possible bullying, because it could be very well that this has nothing to do with her family, and this could actually because of a bully at school who's telling her that she's fat. Kids are at that age, they're very pressured and affected by just kids their own age bullying them. This is the age where bullying kind of starts, so it's just something to probably consider if they go further with this. References include the DSM-5 and a case from the Journal of Child and Adolescent Psychiatric Nursing. All right, thank you.